Oral questions by members.
Leader of the Official Opposition.
Thank you, Mr. Speaker. Over the coming weeks, BC's supply of vaccine is expected to increase, and that is a good thing. It will increase to nearly 275,000 Pfizer doses and more coming from Johnson & Johnson and Moderna. Alberta, Saskatchewan, Nova Scotia, New Brunswick, Ontario, and Quebec are all finding ways to include pharmacies in their vaccination plans, including administering Pfizer and Moderna. But in BC, the government has only talked about pharmacies playing a significant role in giving second doses, which for many people is months from now, and not including them in the first doses that are so desperately needed right now. So to the Premier, why are BC pharmacies not being asked to provide first-dose Pfizer and Moderna vaccinations as they are in other jurisdictions?
Minister of Health.
Well, thank you very much, Honourable Speaker, and thank you to the member for her question. To date in BC, we've delivered, as the member will know, well over 1.6 million doses of COVID-19 vaccine. We've focused first on our long-term care and assisted living homes and did 100% of those in January. More than 80% of all those over 70 have been immunized. 21 local health areas, principally rural ones, have been immunized at more than 50%. More than 60% of those over 60 have been immunized, and 180,000 clinically vulnerable people have also been immunized. We have used, as of today, more than 98% of the Pfizer vaccines we've received and more than 90% of the Moderna vaccine we've received. This is an extraordinary achievement. And pharmacies have played a role as well. As the member will know, we distributed more than 188,000 doses to pharmacies across BC a number of weeks ago of AstraZeneca, and they've been doing an excellent job in distributing this vaccine to British Columbians across the province, such that we have only about 40,000 of those 188,000 doses left to be distributed. So it is a Team BC effort. I think the performance has been simply exceptional. The only thing limiting our vaccine supply is the amount of vaccine we are receiving, and we're going to be receiving more in the coming weeks. Pharmacy is playing a key role in our effort, and I think everyone should be proud of what we've done to vaccinate British Columbians against COVID-19.
Leader of the Official Opposition on supplemental.
Well, thank you very much, and I appreciate the minister's answer. He avoided answering the specific question. We have been told repeatedly that the most important thing that we can do in British Columbia is to get people vaccinated as quickly as possible. This should be an all-hands-on-deck situation, particularly with increased vaccine arriving in our province. The last time, and the minister referenced it, the last time the government called on pharmacies to administer vaccines, it was at the very last minute. And we can all recall that it was so botched that many pharmacies didn't even know they were on the list, and in fact had to find out from media coverage that they were on that list. So despite that confusion and the mayhem of multiple wait lists, British Columbians were enthusiastic about receiving their AstraZeneca vaccine at a pharmacy. And that, too, is a very good thing. British Columbians trust their pharmacists, and they want to get their vaccination in a familiar place. So it's a simple addition to the vaccination plan that the minister has outlined in great detail. Where is the plan to include pharmacies in the administration of Pfizer and Moderna vaccines that is taking place in jurisdictions all across the country?
Minister of Health.
I think, Honourable Speaker, and I say with great respect to the Honourable Member, because we've spoken about these issues, and I know of her support for our efforts to vaccinate British Columbians. When you've used 98% of the Pfizer, when you've used it in a precise way, targeting those that are most vulnerable, those clinically vulnerable, our elders, Indigenous communities, rural communities who are most vulnerable from COVID-19, I think this is the opposite of how the member characterized these vaccination efforts. It has been exceptional, exceptional in service on the ground and the support and the generosity of volunteers and staff and medical staff and in the actual experience of immunization. I think it's been exceptional. I'm not sure how you can do better than delivering 98% of vaccines and being ready and having virtually none in the fridge Pfizer vaccine arrive from the federal government. I think our performance has been excellent. Pharmacists have played a critical role in it. 188,000 doses distributed to pharmacies is not a limited role. It's an important role. And we are going to continue to learn and improve our vaccine performance in the coming weeks. After these slower weeks at the end of April, we are going to receive 276,000 doses of Pfizer. Moderna, less clear. And I think our teams are going to do an exceptional job in delivering it as soon as they can to British Columbians.
Member for Kelowna Mission.
Thank you, Honourable Speaker. Well, I think we should talk about the minister's numbers that he's using, because I do think it is absolutely exceptional that we have delivered 1,635,372 vaccines in 5 months, and I celebrate that fact. What we're talking about, thank you. What we're talking about is the 4,364,628 that we have arriving in the next 2 months. And the BC pharmacists have been left on the sidelines. We have record hospitalizations and staff burnout, but instead of using pharmacists to shoulder the load, doctors and nurses are also administering shots at vaccination clinics. Healthcare professionals are stretched. To the Premier, why is this government adding to the burden on doctors and nurses when we have pharmacists available across BC?
Minister of Health.
Well, thank you, Honourable Speaker. And I guess I can repeat that 188,000 doses of AstraZeneca were delivered to community pharmacy, over 640 pharmacies across BC. That demonstrates our commitment to using community pharmacists as a key part of our immunization campaign. I note that our strategy in BC, and this is why we were first to complete long-term care homes, is to focus on the most vulnerable, to ensure that rural and remote communities were supported, that all 205 First Nations communities had full clinics, that we could deliver 180,000 doses to the clinically vulnerable. I think the strategy has been exceptionally delivered. And I want to be clear, it hasn't been delivered by me. It's been delivered by doctors and nurses and pharmacists and volunteers in every community in BC. I am so proud of this effort. You cannot, I don't think, do significantly better than we've done in delivering the vaccine we've had. You can't do much better than 98%. And we would finish and go to 100% today if we didn't receive more Pfizer vaccine. So the performance has been exceptional. Pharmacists are playing a key role. They're going to continue to play a key role. And I think all members of the House would agree that we need to continue, as we receive more vaccine in May and June, to focus on those most vulnerable and protecting British Columbians, and we intend to do just that.
Thank you. Member for Kelowna Mission Supplemental.
Thank you, Mr. Speaker. Again, with all due respect to the minister, this is not about expiring AstraZeneca. This is about the United States and most other provinces that have been using pharmacies for Pfizer and Moderna vaccinations. BC pharmacies should be fully activated, but under this government, they're not. This is what pharmacist Jason Cridge has to say, and I quote, "The vaccine distribution so far has been very patchy and very uneven. There's no real rhyme or reason as to why that's happened," end quote. To the Premier, he had a full year to plan. Why is there not a detailed plan to better use pharmacies?
Minister of Health.
Honourable Speaker, we presented our detailed immunization plan first in December, then in January, and we have delivered on that plan. We focused first on our elders, of course, and people in long-term care and assisted living, and we delivered. We focused on those clinically vulnerable, and we delivered. We focused with our partners in the First Nations Health Authority, and we delivered. And when I say we, I mean all of us delivered in an extraordinary way. And with respect to AstraZeneca, when it arrived, and it arrived, as the member will know, at the end of March, and about 188,000 doses that came in that case from the United States. We employed our pharmacy network to help deliver that, and I am proud of their work and congratulate them for our work. The only thing that is inconsistent
Ministers,
about vaccine delivery is in the
Minister,
arrival
just wait,
back
please.
to BC, but we have delivered it when it arrived, and I'm very proud of that.
Members, come to order. When the minister is answering virtually, he can't hear you, so there's no point of going back and forth. Leader of the third party.
Thank you, Honourable Speaker. We often compare our pandemic responses to other countries and other provinces. Indeed, it seems there's a lot to learn, both from the failures and successes of other provinces and countries. Here in Canada, we have the Maritime provinces, which have been very aggressive in their response to COVID-19. With a recent uptick in cases, let's consider the steps they are currently taken. On Monday, with a population of less than 1 million and a total active case count of 323, Nova Scotia processed 11,335 COVID tests and reported 66 positive cases. Rapid tests are available to anyone in Nova Scotia over the age of 16, whether they are exhibiting symptoms or not. All schools in the Halifax Regional Centre and some surrounding communities are closed, and the people of Nova Scotia have been told to stay in their own communities. The positivity rate in Nova Scotia right now is 0.6%. The positivity rate in BC is 9.3%. My questions for you, Honourable Speaker, is to the Minister of Health. Interesting, I'm being heckled on this, Honourable Speaker. It appears from the actions that Nova Scotia is taking, is that it remains committed to keeping COVID-19 cases as close to zero as possible. What is our goal in BC?
Minister of Health.
Thank you, Honourable Speaker, and thanks to the member for her question. Our goal, first of all, is to reduce transmission as much as we can and protect the most vulnerable. And that's been exhibited in our strategy around vaccination, in our strategy since the beginning of the pandemic, one that I think is broadly supported across British Columbia. Our goal is to ensure that our healthcare facilities are not overwhelmed by the real challenges faced with current case counts of COVID-19. Our goal is to ensure that people in communities, people with other healthcare issues, because I remind the member and everyone else that there are approximately 7,900 people in hospital with other conditions than COVID-19, to ensure that people with health and mental health issues get the supports they need. Our goal is to ensure that the impact of the pandemic on those most vulnerable is restrained, and our goal is to make sure that other social conditions, such as keeping schools open, are maintained. We had a discussion with the member's colleague yesterday with respect to rapid testing. Our goal is that on decisions on such as rapid testing, that we are focusing right now on the 2.5 million PCR tests we've done in British Columbia. Our goal is to support public health experts like Dr. Henry as they do their job, and not give them instructions that would divert resources from where they're most needed.
Leader of the third party on supplemental.
Thank you, Honourable Speaker. And the Minister says that at the top, the goal is to reduce transmission. My question really is around the role that he sees testing playing in reducing transmission. Let's compare Nova Scotia's response to our own. For Monday, April 26, British Columbia had a total active case count of 8,199. We processed 8,236 PCR tests, and we reported 763 positive cases. We have more than 5 times the population of Nova Scotia and 20 times the number of active cases, and yet we processed 3,000 fewer case tests over the equivalent period. BC has 2.7 million rapid tests available, but currently only for approved work sites. We have used less than 1% of those tests, and yesterday, when the Minister gave no clarity for when and how those tests will be used, we are coming back and asking again. Jurisdictions that have pursued elimination strategies compared to balanced mitigation have experienced less economic decline, supported higher rates of mobility, and experienced less uncertainty and enjoyed far more flexibility in dealing with the pandemic over time. My question, Honourable Speaker, is to the Minister of Health. Will he commit to rapidly distributing the 2.7 million rapid tests in our stockpile to schools and workplaces? And will he indicate how his government is moving to further implement home-based rapid testing in BC?
Minister of Health.
Thank you. The member will know, and I know she knows this fact, that the home-based rapid testing has not been approved in Canada yet. It has been used in the United Kingdom, and there's a significant debate about the effectiveness of that. In addition, other jurisdictions where politicians have intervened to force more asymptomatic testing, the results have not been positive for those jurisdictions in terms of the application of resources. Our priority is to support British Columbians through this very difficult process, to work with them to reduce transmission in community, to use immunization on our most vulnerable groups, to ensure and to reduce the worst effects of COVID-19, and to work in our hospital system to ensure not just those with COVID, but everyone receives the care they need and deserve. I think this approach is broadly supported in British Columbia. It's led and the advice is given on questions that are important questions of transmission, such as testing, by public health leaders. And I don't think we want to be in a jurisdiction where politicians overturn that, order, instruct, and tell public health experts in issues such as transmission, how and when they should use tests. The member knows we laid out our strategy for rapid testing in detail to her and everyone else in BC on March the 4th. And we're going to continue to follow that strategy, which uses rapid tests, yes, but uses the gold standard PCR test first.
Member for Kamloops South Thompson.
Thank you, Mr. Speaker. The Premier's budget broke a lot of his promises, but perhaps one of the most significant broken promises was the one relating to providing a provincially funded sick pay program during the pandemic. Last year, the Premier said, and I quote, "We're prepared to go it alone if need be. We do have alternative plans in place," end quote. Mr. Speaker, 1 year later, nobody has seen any plan from the Premier to fund sick pay, and it wasn't in the budget. So my question to the Premier is this. What was the plan that the Premier had prepared to go a year ago, and why did he break his promise to deliver sick pay during the pandemic?
Minister of Finance.
Thank you very much, Mr. Speaker, and I want to thank the member for his question. We certainly have taken a position about how important it is for people to stay at home when they're sick, and that for some here in British Columbia, it is difficult to do without a standard sick pay. And the Premier has engaged, and I have engaged as well with my counterpart federally, to talk about how important it is to have a national program. This is a national issue, and a national program is the right way to deliver this program. And Mr. Speaker, as part of those conversations, the federal government was interested in that program. They delivered their budget the day before we delivered ours, fully expecting that there would be an element of sick pay in their budget. And just like the members opposite, I was disappointed that wasn't the case. And so right now, Mr. Speaker, there's certainly conversation happening on this side of the House about how to proceed with next steps on a sick pay opportunity. Thank you.
Member for Kamloops South Thompson supplemental.
Well, thank you, Mr. Speaker. Well, that would be fine, except that the Premier said that he had a plan to go. He said he had a plan B. He had an alternative plan that was ready to go if the federal government didn't step up and implement a national program. It's been a year since the Premier made that commitment. Here's what his Labour Minister had to say, and I quote, "As the Premier has said, if the feds fail to work with us, I think we as British Columbia will find our own ways. The Premier made it very clear. We don't feel that the businesses should be burdened with the extra cost," end quote. That's the Labour Minister. It's 1 year later, and there's no plan from the Premier to fund sick pay. He couldn't even be bothered to put it in his budget. So again, to the Premier, is that still the plan? Or is the Premier content to break his promise to deliver sick pay during the pandemic.
Minister of Finance.
Thank you very much, Mr. Speaker. And as I said in my earlier response, we were quite disappointed that the federal government made no mention of it in their budget, which was released the day before our budget. We were disappointed. We've certainly expressed disappointment with the federal government, and as a result of that, we are working together on this side of the House as a cabinet and as a government to address what I think, frankly, has been a missed opportunity for Canadians by the federal government, and we're prepared to continue to do the work so that we can continue to take care of British Columbians.
Member for West Vancouver, Capilano.
Thank you, Mr. Speaker. The Premier isn't just banking on the federal government to bail out sick pay promises. It was also part of his failed plan for universal $10 a day daycare. The Premier promised $250 million increase in childcare spending this year, but only delivered $53 million in this budget. That is a quarter of what was promised, and still no $10 a day daycare. Even this government's own data shows that it will not meet the targets they set out 4 years ago. It's not even in the service plan anymore. So the question is to the Premier, are you waiting for a federal bailout instead of keeping the universal $10 a day child care promise?
Minister of Finance.
Thank you very much, Mr. Speaker. Well, Budget 21 certainly builds on the groundbreaking work that this side has been doing on childcare. Our budget more than doubles the number of $10 a day prototypes, not something that the people on the other side ever even considered. That was not even in the realm of possibility. Well, Mr. Speaker, we're doubling what currently exists here in British Columbia. And that means that 4,000 more affordable spaces for families right across British Columbia. And I know that the member probably has another question, and I will save the rest of this fabulous answer for all the things that we're doing to make childcare accessible for families here in British Columbia.
Member for, let me recognize you, member, first. Okay, member, proceed.
Thank you, Mr. Speaker. I didn't hear, and I apologize. I also believe I did not hear exactly what the minister said. I believe it was this government has created 4,000 new childcare spaces since 2017. Which is true according to what we've looked at, which is about 16,000 less than was promised. But these broken promises, they matter to the families that are struggling through this pandemic. Paul Kershaw of Generation Squeeze, quote, "Thousands and thousands of families during this pandemic are going to be struggling with childcare costs that are equivalent to another rent or mortgage-size payment on top of already higher housing costs," end quote. Instead of delivering universal $10 a day daycare, this Premier is choosing to let families struggle. Will the Premier dip into his $1 billion contingency fund to deliver universal $10 a day daycare?
Minister of Finance.
Thank you very much, Mr. Speaker. Well, I'd be happy to share with the member that over 36,000 families now receive childcare for $10 a day or less. And there's more on the way. There's more on the way. And I have to say, Mr. Speaker, now that the federal government is finally at the table, we'll be able to do it much faster. Thank you very much, Mr. Speaker.
Member for Richmond North Centre.
Thank you, Mr. Speaker. The Premier has a habit of promising something, re-promising it, and then breaking that promise. The Premier has told my Richmond constituents twice, not once, since 2017, that the NDP would build a new acute tower at the Richmond Hospital. And yet, this budget shows the project is still not approved, and there's no money or timetable to advance it. The MLA for Richmond, Steveston, promised I quote, shovels in the ground in 2021. Can the Premier tell us why the Richmond Hospital Tower was a priority before his SLAP election, but not after it?
Minister of Health.
Well, Honorable Speaker, unfortunately, the Richmond Hospital was not a priority prior to 2017. However, it has become a major priority of the government. A concept plan was approved. That concept plan was upgraded and the project was expanded. And we're proceeding to build the Richmond Hospital.
Member for Richmond North Centre on supplemental.
Well, thank you, Mr. Speaker. I guess the minister is lacking a concrete response to my question. The pandemic has shown yet again how important the hospital is to my community, despite the fact it's overcrowded and does not meet current building codes. The Premier promised in July to be back in the fall to advance the project, but he decided on an election instead. The project is over 6 months behind. It's still not approved. There's no money, and our community is concerned. And the NDP MLAs in Richmond have been sitting silently on the sidelines, refusing to stand up for patients. Why is the Premier stalling on keeping his promise to the people of Richmond for a new hospital tower?
Minister of Health.
Honorable Speaker, it will be more than a hospital tower. It's a significant project. It's at a high priority in Vancouver Coastal Health's capital plan. It's been approved at concept plan stage, and the minister is a former member of the Executive Council to know that that means there is money attached to the project, and a lot of it, and a lot more than was originally in place when we first approved the concept plan in 2018. This will be an extraordinary project. We are building the hospital for the coming decades in Richmond. We've made it a priority when it had never been a priority before. The member talks about months of delay. There were years of delay. And that's why the Richmond MLAs who are advocates for this project, including the member, are going to be delighted as we move forward in this project in the coming years, because it is needed in Richmond, just as the new urgent and primary care center is needed in Richmond, which we've just opened, just like increasing the support for seniors in Richmond was needed, and we delivered on that too. We're going to continue to support the healthcare interests of the people of Richmond.
Member for Fraser-Nicola.
Thank you, Mr. Speaker. The Premier seems to have his bungling act down pat. Roll into town, make a big promise, make it again, and then just forget about it. Latest example? No new funding for a new Burke Mountain School, and that threatens the project's future. Trustees wrote, I quote, "An aspect of the urgency in securing funding is that a promised school opening date of September 2023 is now unattainable." Also, in Vancouver Falls Creek, the Premier promised a new school for Olympic Village. Any guesses as to whether they got it? They did not. My question is to the Premier. How many more schools are you going to promise and not deliver on?
Minister of Finance.
Thank you very much, Mr. Speaker. Well, you know, I find it absolutely fascinating to hear from the members across the way to talk about schools, because let's be suddenly, they're suddenly interested in building schools, Mr. Speaker. Suddenly, they think it's, and so I have to say, the member wants to talk about portables. Well, I'm happy to talk about portables because in Surrey, this is the first year, Mr. Speaker, where they don't need to buy a portable. You know why? You know why Surrey doesn't have to buy a portable? Because we've been building schools in Surrey. We are making up for lost time because the members opposite continued to ignore the needs of our children. They continued to ignore the fact that they needed schools. And so we've been working, trying to make up for lost time, and we're going to keep doing just that, Mr. Speaker.
Opposition House Leader.
Thank you, Mr. Speaker. It's unfortunate the Finance Minister decided to ignore a question about Burke Mountain, which is, last I checked, I believe, in her riding. But, Mr. Speaker, it's not just these education promises that we've seen the Premier walk back on and break his promise on. In Kamloops, the Premier made it very clear during the election, came to town a day after the member for Kamloops South Thompson and myself announced enhanced cancer care for Kamloops, and said that would happen in Kamloops as well. Then he came back a week later and doubled down on that promise and actually said it would happen in 4 years. Now, Mr. Speaker, the last time the NDP were in Kamloops promising cancer care was 1991, I believe, and I believe it was then Premier Harcourt. Next thing you know, election's over, cancer centers in Kelowna, not Kamloops. Now, as the machines age out of useful life, they need to be replaced in Kelowna. Fully 2 of the 5 get used by residents of Kamloops. The Premier knows this. The Premier committed to 4 years, yet the Health Minister, as recently as this week, has been on Radio 1L saying 10 years. So to the Premier, is the Premier going to fulfill his commitment made in the election very clearly on a very specified trip strictly to talk about a 4-year cancer plan to Kamloops and deliver a proper cancer centre in Kamloops in 4 years, or is it going to be 10 years or probably even longer if the NDP track record is any indication?
Minister of Health.
Honourable Speaker, we believe that cancer care is an important priority everywhere in BC, and that's why we've expanded access to care, to treatment, to testing in all regions of British Columbia. I think a real achievement of this government, but I say importantly of everyone involved in cancer care in our province. In the election campaign, we presented a 10-year cancer plan to address what's clearly going to be a growing problem. We have improved outcomes, which is tremendous. We have enhanced life expectancy over 65, which means more age-related cancer. And we need to plan and prepare and provide the resources now. And that includes providing more cancer care in regional centers such as Kamloops, something that, by the way, wasn't done in the years prior to 2017 in the way that it needed to be done. We've continued, of course, to focus on delivering. These projects take time on the Royal Inland Hospital project in Kamloops. And we're delivering on our 10-year cancer plan, as the budget shows, and as we intend to do, because we believe that care closer to home in communities such as Kamloops, but also other communities such as Nanaimo, is important to provide the care necessary for British Columbians. Cancer care is fundamental. You need an organized plan to address the situation that's in front of us. Major challenge, and Kamloops is an important part of that. I'm proud to talk about the care we're going to be delivering in Kamloops and the priority we're giving to cancer care in that community. And I hope all members, especially members in Kamloops, will join in that support.
Thank you. The bell ends the question period.